the nerves of the pelvis, and the main components of the nerves are the sacral plexus. Okay, and sacral plexus, if you see the sacral plexus, it is where it is formed. It is formed on the posterior wall of the pelvis. Posterior wall of the pelvis. We already know that the spinal cord is running in the vertebral canal and also reaches up to the sacral canal. Okay. After that, what happens that within the sacral canal, same in the like above, they divide into anterior and the posterior rami. So in the formation of the sacral plexus, as it is located in the posterior wall of the pelvis, where we know there is attachment of a muscle which is named as the piriformis muscle. Okay, on each side, and that is in a E-shaped manner on each side, on the lateral side of the ventral or anterior sacral foramen. Now from this aspect, plus there is combination of two ventral rami of L4 and L5. That is the fourth and the fifth lumbar nerve. Plus we have first, second, third and fourth sacral nerve. That is ventral rami of the fourth and the fifth lumbar nerves, plus the ventral rami of first, second, third and the fourth sacral nerve. They unite and form a plexus of nerve which is named as the sacral plexus. Now the ventral rami of the fourth and the fifth sacral nerve, they unite and form a single trunk which is named as lumbosacral trunk. Now the ventral rami of the fourth and the fifth, they form a lumbosacral trunk. Then they unite with the ventral rami of first, second, third and the fourth sacral nerve and forms the sacral plexus. And these rami, if you draw a diagram over here like this is the sacrum. Okay, and every rami, they are coming out from the upper four ventral sacral foramina, and from above there the fourth and the fifth ventral rami of the fourth and fifth lumbar nerves, they unite and they enters into the pelvic cavity in the area where we have the sacroiliac joint, and then they unite, or you can say they turns towards the midline and take the union of first, second, third and fourth sacral nerves to form the sacral plexus. And we already know that this is what is this? This is the piriformis muscle. So that's why we say that the sacral plexus, it is formed on the posterior wall of the pelvis in front of the piriformis muscle. By the union of the lumbosacral trunk, that is the ventral rami of the fourth and the fifth sacral lumbar nerve, which unites with the ventral rami of first, second, third and the fourth sacral nerves. So this will result in the formation of the sacral plexus. So you must be able to know, to explain that what is sacral plexus. It is the plexus of nerve fibers which supplies the viscera of the pelvis, plus the muscles their branches, they supply the lower limb also. Some of the muscle or the part of the lower limb also. So, and where it is formed? It is formed the posterior wall of the pelvic cavity in front of the piriformis muscle. Okay. So here you can see these are the ventral lemma as L4, L5, and then S1, S2, S3, and S4. They unite and form the whole of the sacral plexus. Okay. Yes. Then if
Lumbosacral trunk consider with this plexus or?
yes, this is the part of the sacral plexus. This is the part of the sacral plexus. So if you see the relation is it is lying on the posterior pelvic wall, behind it, in front of piriformis muscle, and if you see anterior to this, what is anterior to this? It is the internal iliac vessels. Internal iliac vessels plus, and there is also the intestinal organ named as the rectum. So it is related anteriorly to the internal iliac vessels and the rectum, while posteriorly with the piriformis muscle. Clear? Okay. So these are the relation. And lumbosacral trunk. What is lumbosacral trunk? It is formed by the union of fourth and the fifth lumbar nerve. Now, if you see the branches of this sacral plexus, they are divided into you can say different parts. Like first branch is that they are the branches which supplies the pelvis, and some of the branches which originate from the sacral plexus, but they leave the pelvic cavity to supply the lower limb muscle. You have already done the lower limb, so they are supplying the lower limb muscles. Third is the perforating branches. So first, if you see the what are the branches in the pelvis, first branch is the pudendal nerve, and the root value of the pudendal nerve is S2, S3, and S4. Now what happens? If you see over here, this is the pudendal nerve. Okay, this is the pudendal nerve. Pudendal nerve, after its formation from S2, S3, and S4, it leaves the pelvic cavity. It leaves the pelvic cavity from the greater sciatic foramen. Before leaving, it gives some branches to supply the pelvic structures. When it leaves from the greater sciatic foramen, it re-enters the pelvic cavity from the lesser sciatic foramen. Because between the greater and the lesser sciatic foramen, there is pelvic diaphragm. So it has to supply the perineum. It leaves from the greater sciatic foramen and re-enters the pelvic cavity from the lesser sciatic foramen. Okay, so this is first branch, the pudendal nerve. Then second branch is nerve to piriformis, same, which is supplying to the piriformis muscle within the pelvic cavity. Next, third one is the pelvic splanchnic nerves. Pelvic splanchnic nerves are having the root value S2, S3, and S4, and as their name indicates, they are the branches which are formed by these three sacral ventral rami. They supply the visceras of the pelvic cavity. So these are the branches which are present or which supplies the pelvic walls or the pelvic visceras. Okay. Then we have the branches which are originating from the sacral plexus, but they leave the pelvic cavity to the greater sciatic foramen. First we have done is the pudendal nerve, which is also one of the content, but it is supplying the pelvic cavity. Now, which are the branches for the lower limb or the leg? First one, largest one is the sciatic nerve, and the root value of the sciatic nerve L4, L5, S1, S2, and S3. And it is the longest nerve of the body. Longest nerve of the body which is present in our body. Second is the superior gluteal nerve. Superior gluteal nerve. All these three which we are talking in the leg, they are leaving the pelvic cavity from the greater sciatic foramen. So first and the largest and the longest one is the sciatic nerve. Second is the nerve, superior gluteal nerve, and the superior gluteal nerve, it supplies the gluteus medius and the minimus. Okay. Then we have the inferior gluteal nerve. Inferior gluteal nerve, it also supplies the gluteus maximus nerve. That is inferior gluteal nerve supplying to the gluteus maximus muscle. Then nerve to quadratus femoris. These are all basically the muscles of the lower limb or the back of the thigh or the medial aspect of the thigh. Nerve to quadratus femoris, it also supplies the inferior gemellus. Nerve to obturator internus, it also supplies to superior gemellus. And the last one is the posterior cutaneous nerve of the thigh. Posterior cutaneous nerve, as the name indicates, is supplying the posterior aspect of the thigh and the buttocks. Yes, any question?
Superior gemellus.
Superior gemellus. These are the two muscles. If you remember, there are two gemmelli, superior gemellus and inferior gemellus, and just above the quadratus. Quadratus femoris, above the quad. When you have done in the posterior aspect, you remove the gluteus maximus, medius and minimus. Then below this, you have the two gemmelli, superior and the inferior gemellus, between them as the quadratus.
All these branches go out from the.
Yes, they
little-
leave the pelvic cavity from the greater sciatic foramen. They are not supplying within the pelvic cavity. And then third part is the perforating cutaneous nerve. Perforating cutaneous nerve, they supply the medial aspect of the buttocks. Medial aspect of the buttocks, that is the area around the anal opening or the anus. Okay, so this area is supplied by the posterior cutaneous perforating branches. So these are three types of branches we have gone through. One is the branches which are supplying the main pelvic viscera within the pelvic cavity, and the other are the branches of the plexus, but they leave the pelvic cavity to the greater sciatic foramen. Third are the perforating cutaneous nerve, the perforating cutaneous branches. Okay? Is it clear? Sacral plexus? Yes. Any question? This diagram shows the relation that how these this is the piriformis muscle which is located, and they are anterior to the piriformis muscle, and further anteriorly in the midline we have the rectum, and then on each side we have the internal iliac vessels. When we come to the arteries of the pelvis, arteries of the pelvis comes from the common iliac artery. Okay, common iliac artery arises, as we already know, it arises from the division of the abdominal aorta at the level
L2.
L4. Okay, at the level of L4. Then the right and the left common iliac arteries goes toward the right and the left side. Then when the common iliac artery that is on the right or the left side, they reaches or they enters into the false pelvis, and when they reaches to the anterior aspect of the right or the left sacroiliac joint. You can see the sacroiliac joint. This is the sacroiliac joint, and then it divides into internal and the external iliac arteries. External iliac artery, it runs over the lateral aspect above the pelvic ring. Remember, external iliac artery runs after its origin runs laterally over the pelvic ring, because and then it rises where it reaches in this area. That is, what is this area? This area is below the inguinal ligament. Okay, this area is below the inguinal. So the external iliac artery, after its origin, it passes laterally where here we have the sacroiliac joint. Then it passes laterally, and this is the pelvic bridge. Okay. Now this external iliac artery passes laterally, and here what we have? Inguinal ligament. This passes below the inguinal ligament and becomes continuous with the femoral artery. Now, before going down to become the femoral artery, the external artery gives rise to two vein branches. What are these two vein branches? They are inferior epigastric and deep circumflex iliac artery. Inferior epigastric and deep circumflex iliac artery. You see in this diagram. Here, these are the two branches. These are the two branches, the deep circumflex iliac and the inferior epigastric artery. After that, it passes down below the inguinal ligament to become the femoral artery. So the external iliac artery does not enters into the pelvic cavity. Remember, okay? External iliac artery is not entering into the pelvic cavity. Then the arteries which are the arteries of the true pelvis, or you can say they are entering into the pelvic cavity. And these arteries are the internal iliac artery, median sacral artery, ovarian artery, and the superior rectal artery. These are the four arteries which are entering into the true pelvis. Remember, know the external carotid artery. Internal iliac artery, median sacral, ovarian, and the superior rectal artery. Now, if you see the ovarian artery, from where it arising? It is arising from the abdominal aorta. Okay? And then it passes down, enters into the pelvic cavity at the front of the sacroiliac joint, then it passes down or the lateral pelvic wall, and then I will show the broad ligament. It enters laterally into the broad ligament to enter, and then it supplies to the ovary. Okay. Second is the superior rectal artery. Superior rectal artery is nothing but it is the termination or terminal continuation of the inferior mesenteric artery. Clear? Median sacral artery same, which is at the division of the common iliac artery or the posterior aspect. It arises and it runs over the ventral aspect of the sacrum in the midline. This is the median, that's why it is named as the median sacral artery. So, ovarian artery arising from the abdominal aorta.
Median sacral.
What is second?
Median sacral.
Median sacral artery arises at the division of the
Common iliac.
iliac and then passes along the anterior aspect of the sacrum. Third is the
Rectal artery.
superior rectal artery. It is the termination of the inferior mesenteric artery. Okay. Then one thing you should keep in mind that where if there is ovarian artery, where is the testicular artery? Sorry, where is the testicular artery in male? Take it out. Where is the testicular artery in male?
from the abdominal.
Where it goes? Yes, testicular artery. Ovarian artery enters to the pelvis. Testicular artery does not enter into the pelvis, but it enters along with the spermatic cord into the inguinal canal and goes towards to supply the testis. Okay, so this is the difference, that the testicular artery is not entering into the pelvic cavity, but the ovarian artery entering into the pelvic cavity.
Lec2.